And we are live. Hey, everybody, I want to welcome you to Winning Against Regain and to this video call with Connie, Dr. Connie Stapleton, who is a licensed psychologist, author of Weight Loss Surgery Does Not Treat Food Addiction, Thriving, Triumph Over Trauma. I got that one. And Eat It Up. And she is also the therapist to TLC's hit series, 1,000-Pound Sisters. So with that, Connie, give Connie a warm welcome to this video series. And if you guys comment, just a housekeeping item, if you guys comment, please accept that StreamYard can use your name so we know who commented, and we'll address the comments during the show. So welcome, Connie, and thank you for taking your time to do this video call with me.
Are you kidding? I love doing this kind of stuff, and I so appreciate you reaching out. This is such a huge topic, and it is something that so many people struggle with and don't expect it when they're going into weight loss surgery. So yeah, it's a good topic. And I won't see the comments, right? I don't think I see the comments, but you can. Oh, there I can. Okay, very good. All right, but feel free to stop me at any point in time, okay? If you want to ask questions or I can't hear you.
I muted me.
Okay.
I will post them up as well.
Okay, perfect. All right, so very quickly, by way of introduction, my name is Connie Stapleton, and how I got into bariatric work is I'm a recovering alcoholic. And although my drug of choice, and I'm a recovering, I guess, drug addict, my drug of choice was pain medication, prescription pain medication, which I kind of stumbled into when I was put on them for treatment of headaches. I come from a long line of addiction. I did my own outpatient treatment, and then I went to many years of therapy to dig through my own issues. After I went through many years of therapy, I went back to school because what I wanted to do with my life was to help people find the kind of life that I never knew existed until I got free from the bondage of addiction. So the disease of obesity and the disease of addiction oftentimes go very hand in hand, but before people have surgery, they're not always aware of that. So I just want to explain a little bit about how those two things go together: obesity, the disease of obesity, and the link to addiction for a certain subset of that population. Not everybody who has weight loss surgery has a food addiction. Not everybody who is overweight has a food addiction. I have a food addiction, and I was severely underweight. So it can run the gamut. Weight is not a determining factor of food addiction. But everybody who has weight loss surgery has to understand what surgery will do and what it won't do. What it will do is give you the chance to get rapid weight loss, something that has eluded people for a long time. There are so many factors that go into the disease of obesity, and some of those make it very difficult to get any of the weight off in spite of really good efforts. So the surgery gives you an opportunity to get that weight off, to improve your health, to start developing the kind of lifestyle that Tasha works with you to develop in this program. So regain is common. You know, regain is common. And part of the reason for regain has to do with food addiction, not for everybody, but again, for some people. What bariatric surgery will not do is guarantee weight maintenance. Not at all. It helps you get that weight off. Then you got to work your butt off. Doing what Tasha's telling you, helping you to learn those habits to keep the weight off. Surgery won't prevent you from making poor food choices. It just doesn't, right? Some people think they can't eat sugar. Well, you know darn well that most people can't eat sugar without dumping. Dumping only occurs for 40 to 50% of people. And weight loss surgery does not treat food addiction. And I wrote that book a couple of years ago, and I've been working in this field for like 15, 16 years. And what I came to realize, and I realized this soon after I started working in this field, is that when I went through treatment for my specific addictions, which, like I said, were pain medication and alcohol at that time, that was the beginning. It wasn't, I thought, oh, I'll go through this stupid thing, shut my husband up, and get on with my life. every single thing in my life changed. When you have weight loss surgery and you lose all that weight, pretty much everything in your life changes, and that is just the beginning. So a lot of people find out after they've had surgery what that relationship with food is about. And for some people, they find out that food was a way to numb their emotions, was a way to not feel or deal with things they were used to dealing with. And a lot of people find themselves drinking alcohol because guess what? After surgery, as you know, alcohol wipes out those emotions and those feelings in a real quick moment, right? So there's a transfer of addiction. Now I'm jumping way ahead of myself, and I want to talk about the continuum of food addiction. So if we're at one end and we go to the other one, and imagine this end isn't so bad and this end gets worse and worse and worse. And it's the same with any addiction. So I've done training in all sorts of addictions. I spent 2 years studying, going to courses on the treatment of sex addiction. I spent several years studying the treatment of alcohol and drugs. This is no different. It's like if you have an umbrella and the spokes on the umbrella all go to a different addiction, they meet at the top. And addiction is addiction. It just comes out in different ways. And it's very rare that a person has just one addiction. They either transfer one to another, to another, to another, to another, which I did. So when I was younger, my first addiction was food. Then I started drinking. Then I switched to the pain medication. Then it was boys because I was in college. So it was a lot of boys. I always joke someday I'm going to write a book called My Life as a Teen Slut. But then it was work. Then it was, it was whatever it took not to be alone with me. Because when I was alone with me, I didn't like what I felt like. I didn't like how I didn't like looking in the mirror. I didn't like me. And a lot of that stemmed from, and a lot of addiction stems from earlier childhood stuff. The core of every single addiction is rooted in shame. Shame meaning I don't feel very good about myself. There's something wrong with me. I'm just not as good as the others. Wherever that comes from, there's a piece of that in all addiction. Now, if you struggled with obesity, most people who suffer from obesity feel a sense of shame, right? Because the world shames you. It's really difficult because you're shamed all the time, which just fuels that sense of what's the matter with me. So at the lower end of addiction is emotional, right? It's psychological dependence. Addiction and dependence mean the same thing. So if you're addicted to something, you're dependent on it. And what are you dependent on? For a lot of people, it's the feeling you get when you use these substances, or it's the feelings you get rid of by using these substances. So maybe you're anxious or stressed or upset and you eat some sugar, all of a sudden you feel better. Or you take a drink, or you spend too much money, or you, whatever it is, it's just like your mind is all focused on that, right? Even if it's the feelings of, what did I just do? Why did I do that? It keeps you from feeling other things. It keeps you from dealing with the present. So I never had a physiological addiction to alcohol. Like you think alcoholic and you think the person who wakes up and they're shaking and they have to have a drink in the morning. That was never me. I could function just fine without it. But in my mind, I thought, I don't want to face the public. I don't want to go out with my friends tonight. I don't have anything to say to anybody. So I thought if I drank or if I popped pain medication, it would loosen me up. And it did. It was a psychological dependence. I thought I had to have it. And that's kind of where emotional eating lies on that continuum of addiction. So some people, if they're at work and they get upset, they reach into the drawer, they pull out a piece of candy, they eat it, and they don't even realize they're frustrated, and so they're eating. So some people don't have a biological addiction to sugar or processed foods. It's just, I think I need something. When I'm stressed, the they portray this in the movies all the time. The women sitting on the couch with a pint of ice cream, eating away at their feelings. That's kind of what emotional addiction is. So if you're an emotional eater, there's a chance you could be, have a physical or a psychological and emotional dependence on food. You count on it to make you feel better, right? So emotional eating is at this end of the continuum. If you get further along, and if you think in the world of alcohol, it's the people who literally, they don't feel normal unless they're having alcohol in their system. Without alcohol in their system, they're going through withdrawals, right? Now, sugar can affect the brain in very similar ways as alcohol. When I went through treatment 31 years ago, before I left there, they had this research that long ago. They said, you have to be aware that sugar and white flour can trigger your brain in a very similar way as can alcohol. So let's say you have this physiological, meaning biological addiction. If you eat sugar or if you eat a lot of processed foods, do you or have you experienced like brain fog? Some people are just like, I feel kind of like I'm in a fog. Or conversely, if you quit using sugar or you quit using processed foods, do you go through a withdrawal? Like you get headaches and you feel really lethargic and you feel nauseous and you just feel really weak. That might be a sign that your brain responds very quickly to sugar. Remember, they tell you, and most programs don't tell you this, but I tell everybody when I do a pre-surgical evaluation, 1 drink after surgery hits your body like 3. So 1 beer equals 3 beers. 1 glass of wine, 5 ounces, equals 3 glasses of wine. 1 shot of liquor equals 3. So very quickly, when the surgeon takes food away from you when you have bariatric surgery, and for a while, you're not eating much, right? In those initial days and weeks, you're going through withdrawal and you're going to know it. And when you eat sugar again, sometimes you feel like, okay, this is me. I feel better. So there's a continuum from psychological, meaning I just need this because this is how I deal with emotions, to my body's hooked on this stuff. And both are very, very real. I'm going to go through a little quiz. Now, I don't want you, falling apart here if you meet the criteria for addiction, but I want you to understand what the medical community and the psychiatric community consider to be addiction, okay? But before I do that, I just want to say that there's a lot of discrepancy, even in the medical community, about addiction. There are a lot of medical professionals and a lot of medical professionals in the bariatric world that don't believe in food addiction at all. Makes me crazy. So part of what I aspire to do in my career, in my work, is to educate not just the patients, but the professionals. Because I was at a conference and I was speaking on a panel, and the moderator of the panel, I had listened to a podcast he had done, and it was brilliant. He was really, really brilliant. But in that podcast, he said he didn't believe in addiction. And so when I was sitting with him, I said, boy, I listened to that. I thought it was really, really great. I said, but I sure have different opinions about addiction. And he said something very unkind and inappropriate. But what he did was he got up in front of the audience, and the discussion wasn't about addiction at all. But he got up and the room was filled with patients. And he said, how many of you consider yourself to be a food addict? And nearly everybody in that room raised their hand, which I was really glad about, because he doesn't believe in food addiction, but a lot of patients know that it's a real thing for them. So there's a lot of debate. And, the disease of obesity was not considered a disease when I started working in this field 15 years ago. The American Medical Association did not declare obesity a disease until 2013. Alcohol addiction was declared a disease in 1956. So addiction was considered a disease long before obesity was. And that's crazy, right? I mean, both are diseases. They affect our systems. They're chronic. They don't go away. You can work on remission from them, but that's insane. So in the past couple of years, they've been adding more and more addictions. They have not added food addiction as something in the medical, you can't code anything food addiction. So it's not considered by the medical condition or community a real disease yet. But I guarantee you it will not be long before it is. So I just thought that was really interesting. All right. So you have weight loss surgery. You go into the OR. On one hand, you have the disease of obesity. On the other hand, you have the disease of addiction. You may or may not know that you have this, right? But you go into the operating room and they treat your obesity. They're working on your obesity. So you come out of surgery and you are an addict seeking a fix. You're seeking a fix. That's why there's so many people who end up with early complications because they eat things that are not going to do well with your system shortly after having a bariatric surgery, particularly sugar. So there's a lot of complications with that, or alcohol. I promise you, I have seen lives destroyed with alcohol to the point of suicide. People that I've worked with following weight loss surgery because that addiction is so strong and they don't understand what it is. So when I do an evaluation pre-surgically, and I talk to people about how much they drink or, if they've ever done drugs, if they smoke, if they, and I ask about their family history. Because just like the disease of obesity, the disease of addiction has some biological components. So a lot of times people will say, oh yeah, my dad and my grandma and my, half of his family are alcoholics. I'm so glad I'm not an addict. And I'm thinking, but are you? Your addiction may be something else. It may be sugar. It may be white flour, but perhaps you're an addict. And I discuss that with the patient. And a lot of times, they're like, I never thought of it like that. And so that's really important. But I want to share, and this is the part that bores the heck out of me, so I will skim over it unless anybody wants any more details about it. But there's a lot of research. This isn't just Connie and her opinions and, who cares, right? But there's a lot of research that's been done about food addiction. And what they say is there's so much research that says just like many other drugs of abuse, food can trigger the brain in the same ways, the same dopamine responses, there's all kinds of neurotransmitters in the brain that are triggered in all kinds of different parts of the brain. I don't try to get into all of that. But the similarities, first of all, there are a lot of biological similarities. Second of all, a lot of studies will show rats and they'll give them cocaine and they'll give them sugar water. And first they'll introduce the cocaine and the rats are all about the cocaine. They want more and more and more. How much cocaine can I get? Well, then they give them the sugar water and all of the rats switch from the cocaine and prefer the sugar. That's how addictive sugar can be. So similarities between overeating and the use of food and traditional substance abuse include a compulsive use, right? It's like, why am I doing this to myself? This doesn't even make sense. It doesn't go along with what I want to do. It doesn't go along with what I believe. So you kind of go against your desires and it makes no sense. It's like, I'm a rational, smart, intelligent person. I know that this is not a good decision, but I do it anyway. My favorite definition of addiction is knowing that something is causing you a problem, knowing you want to stop, and not being able to. Because there's no other reason. There's no other description. It's like, if you know it's not good for you and you want to stop and you've tried to stop, but you can't. And you know the classic line for an alcoholic, I can stop whenever I want to. And I hear that a lot from food addicts too. So they'll stop using sugar, or they'll stop using, eating processed food for a month. Well, big deal. You're back to it a month later. That is not stopping, right? That is like white knuckling it, trying to control it when it's really much bigger than that. So another similarity is craving. A lot of people talk about craving sugar. There's a huge craving. It's like, I can't get this thing out of my mind. And no matter what you do, you're just so hyper focused. So that's the compulsion too. And there's a huge part of denial, right? When my therapist suggested to me that perhaps I could be an alcoholic, I'm like, are you crazy? I'm like, have you met my family? Everybody in my family drinks 1,000 times more than I do. There's no way I'm alcoholic. Sure enough, I am. There's a preoccupation with food, constant thinking about food. And let me give you a little foreshadowing of something I'm going to talk about in a little while. But that preoccupation with food, like so many people say, when I eat breakfast, I think, what am I having for lunch? When I'm eating lunch, I'm thinking, what am I going to have for snack? And so on and so on. Well, here's how people continue that preoccupation with food after they've had weight loss surgery. And they can't necessarily always eat the food, but they stay tuned into that food with the food channel, the Food Network, recipes. They spend an unreasonable amount of time. Of course, you have to learn healthy new recipes. Of course, you have to get some education about food. But if you're spending 3 and 4 and 5 hours a day focused on food, you're active in your addiction. It's just not going in your mouth. It's kind of like the difference between in sex addiction. People aren't, having sex all the time. When they have a sex addiction, they might be on the internet looking at sexual things 5 hours a day. It's the same difference. You're preoccupied, you're involved, you're spending an unreasonable amount of time obsessed with your addiction, right? And then there's guilt. When people stay out, they tell their spouse they're going to be home at 10 and they're out till 2 a.m., they feel guilty. When you eat things in excess that aren't in line with where you want to be, you feel guilty. And then that sense of shame starts to trigger. There's tons of relapse, right? You get on track, and then you fall off the wagon. There's a tremendous amount of relapse in all kinds of addictions. So, do you think addiction is real? You think a food addiction is real? I'm going to give you a quiz. All right. Okay. Let me see how many categories there are here. There are 11 categories. So the most points you can get is 11. All right. I'm going to ask multiple questions within a category, but if you answer any of the questions in the category, you still only get 1 point. All right. Ready? Now you don't have to share your answers with this. Okay. Category 1 is taking the substance in larger amounts or for a longer period of time than you intended to. Well, what the heck does that mean in real terms, right? So let's say that you go to the movie and you've brought your portioned amounts of snacks with you for the movie, or you sit down at home because nobody can go to the movies now, and you're gonna watch a movie, and so you have your allotted amount of snack, right? And by the time that movie's done, there's like 5 additional wrappers sitting there. And you're like, what the heck? I only intended to eat this much. Or you say, I'll just have, a handful of M&Ms. And the next thing you know, you've eaten the full family size bag. So you eat more or for longer than you intended to. So let's say you go to the buffet, which is not a healthy place, probably if you're a food addict, right? And you say, I'm going to get 1 plate full of food and 1 dessert. But by the time you leave, you've had 3 platefuls of food and 4 desserts. So you eat more than you intended to or for a lot longer period of time. That's category 1. So if that fits for you, and this can apply to alcohol, it can apply to anything. And remember, Most people don't just have one addiction. And a lot of people have multiple ones going on at the same time. It could be shopping and food. It could be shopping and internet pornography. It could be food and alcohol. Runs the gamut. All right. So category 2, we've already alluded to this. You want to cut down or stop using the substance, but you just can't manage to make that happen. Maybe for a week, maybe for a month. You want to cut down, you want to stop, but it's not happened. That one's pretty self-explanatory, so maybe you get a point for that one. All right. You spend a lot of time using, eating, smoking, drinking, whatever, a lot of time obtaining this or recovering from it. So in other words, maybe you think, I have to have Krispy Kreme and I have to have it now. And you will drive for 2 hours until you find the Krispy Kreme with the hot sign flashing, right? So that's an example of spending a lot of time getting that, right? Or maybe you send everybody out for the evening and you sit home alone with all your favorite foods because you're just going to have a little sugar fest. So you spend a lot of time eating that. Or it could be chips. It's not just sugar. For a lot of people, it is sugar, but processed foods can be just as addictive. So those really highly processed carbs. Or recovering, like the next day you're like, oh my God, I feel like absolute crap. And you have the sugar withdrawal and you have the headache and you have the lethargy. So that's one category. So maybe you get a point for that one. All right. Cravings and urges that just seem uncontrollable. You have these uncontrollable cravings. That's category 4. Category 5. Not managing to do what you should at work, home, or school because of this use of whatever it is. Now, a lot of people are deceived by this. They're like, my sugar stuff doesn't affect my life. It doesn't affect my job. It doesn't affect my family. Well, let me ask you this. Have you ever been craving something and your mind is so focused on this something and your kid comes up to you and you snap at them? Or you just barked at your husband, or your kid's trying to get you to play a game or help with homework or whatever it is, and you just are not fully present because your mind is tunneled in on, I got to get a fix. I got to get a fix. I got to get my fix, right? So we don't think that our obsession with food or shopping or the internet or whatever it might happen to be is having an effect on people. Or at work, you're so focused on when can I get out of here and go get a Coke? When can I get out of here and go get a Coke? I got to have some sweet tea. You're not fully present to do your job, right? So you might not have thought of it in that way. And I promise you, without failure, anybody who has an addiction is affecting the people in their lives because you're crabby, you're angry, you're upset with yourself, you're focused on the next fix, you're angry at yourself, you're feeling like a lousy person. You're rarely, well, I shouldn't say rarely, but there's always an effect on the people you live with. All right, so far you have a possibility of 5 points. Category 6. Continuing to use even when it causes problems in relationships. My addiction doesn't cause problem in my relationships. That's not true. It causes problems in every relationship you have with every single person. And I know a lot of people bristle at this. I am not saying you can't have some decent relationships. But what I am saying is that anytime there is an addiction present, there is a wedge between you and the people you love. Always, without fail. And it's okay if you're mad at me for saying that because you don't think it's true. And again, I'm not saying you don't have a good relationship with your spouse, but I am saying if there's addiction, it's coming between you. Because when we have an addiction to a substance or a thing or a behavior, that is our primary relationship. And that does not sit well with people because we don't want to hear that. We don't want to believe that. And let me tell you, I was as defensive as they come when I first got into the rooms, because I didn't want to believe that. I'm like, my marriage was not good at that time. And that's one of the reasons I went to treatment. I'm like, you can't tell me I have more of a relationship with this thing than I do my children, blah, 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 blah. But the truth is, I would go off on work weekends. I was in sales with a bunch of people, party all weekend, work some, and be away from my children. That's not a wise decision when you have 3 little children and you're a young mom and your marriage is in trouble, right? So this is something I would really encourage you to spend some time with. And even if you and your spouse are tight, those times when the craving or the feeling bad comes between you means that that addiction is between you. So it's like trying to have a really close relationship, but put a pillow between the two of you. You can't get as close as you could be. All right, so that's category 6. Category 7, again, giving up important social, occupational, or recreational activities because of your use. Now, again, people go, nah, that doesn't happen. Let me ask you some of these questions, okay? Are you able, at your highest weight, were you able to attend all of the events you wanted to? Some people's weight impedes them from being able to attend sporting events of their children's or plays that their kids might be in or piano recitals, or they can't. Maybe they were a great athlete in school, maybe you were, and you can no longer participate in those things. And it's because of, we say it's because of your weight, but it's because of your addiction. You can't get rid of the addiction. Part of my sadness and frustration with the medical community is that we treat the symptom. So for people who have a food addiction or have an alcohol addiction or have a whatever, we go in and we're like, we got to get rid of this alcohol. We got to get rid of this alcohol. We got to do something about this food. Well, with weight, it's we got to get your weight off. We ignore the fact that the food, the addiction is what's causing the weight, or the alcohol is the problem. No, the alcohol is the symptom. I got stuff going on in here that I don't want to deal with. And I need to learn to deal with life. I drink when I'm upset. I drink when I'm sad. I drink when I don't want to feel things. I drink when I don't want to talk about the stuff that happened in my past. I drink when I'm around my family because they remind me of stuff that happened in the past. I drink when, whatever it is. I've got to have an escape. I take a pill when I go into Walmart because I'm so overwhelmed. Well, I need skills to learn to deal with crowds. I need skills to learn to deal with being around my family and not being numbed out emotionally. I need to learn to be fully present in my life, meaning I'm not numbing out with sugar or processed carbs or alcohol or anything. I'm not on my phone, hiding from the world. Live fully present. So if you've given up, if your addiction has caused problems in your life, it's more than just treating. It's more than just getting rid of sugar. That's step 1, right? But we also have to learn what's so difficult for me about being out in the world. What's so difficult about my family? What don't I want to talk about from when I was a child? Where does this shame that I've carried with me my whole life come from? But that's not category 7. Category 7 is, have you given up stuff because of your weight or your addiction? Category 8, you're using the substances again and again, even when it puts you in danger. Here's something I did with my food addiction that could have killed me and other people. You know how people drink and drive? Not good, right? I did that too, a lot. But when I was in my food addiction and I was anorexic, I would chew food up, spit it out into a cup when I was driving on the highway. And I can't tell you how many times I would look up and I would be in the wrong lane. That's dangerous. Or driving when you're so intent on just getting to the store and you got to get that exact kind of ice cream and you're not present, right? So it can put you in danger. So using again and again, even when it puts you in danger. All right. Not everybody gets that one. I sure did. All right, category 9, continuing to use even when you know you have a physical or psychological problem that could have been caused or worsened by the substance. Okay. Everybody gets a point for this one if you're here. Because if you had struggle with your weight and it was causing physical problems or it was causing relationship problems, but a lot of people have medical problems associated with their weight, and yet you continue to do it, yeah, absolutely, you get a point for this because you continue to do it. You know, a lot of doctors are like, you got to get rid of some of this weight, or your risk for stroke is really going to increase, or you're right on that border of diabetes. And who wants diabetes? But we can't change the behavior with the food, which puts us into diabetes. Logically, that makes no sense. Just like logically, it makes no sense for people to say, I'm paying $27,000 to have bariatric surgery. Why would anybody regain their weight? Well, logically, nobody would, right? But if you have an addiction holds the trump card because we behave in ways that don't go along with what we want. That's addiction. All right, category 10. You need more to get the effect you want. You develop a tolerance. So with alcohol, it's pretty easy to see tolerance. You drink a drink and you're 16 and you drink a drink and you're like, whoa, and then you're like, I know how to feel better. I'll have a drink. And then pretty soon it's like you drink a drink and nothing happens. So you have 2 or 3 and you're like, oh, there it is. Right? So you need more to feel the way you did the first time. Or same with pain medication, narcotics, opioids. You have some and then you build up a tolerance. And that's why people can ingest ungodly amounts of, it amazes me what the human body will tolerate. But they have to keep taking more and more and more to get the same effect. What about sugar? Maybe a candy bar used to take the edge off, right? But maybe then it's like, I still feel so much frustration. So it's like a candy bar and a Coke. And so that works for a while. And then it's a candy bar and a Coke and an ice cream bar. Do you have a tolerance? And then the last one is withdrawal. So, with alcohol, if you have, even people who aren't physiologically addicted, a hangover is withdrawal, right? You don't have the chemical in your system. So you feel the withdrawal of it. But people who are physically addicted on the end of the continuum, they're the ones that wake up like this. They're the ones that have to drink to feel normal. With sugar, it's the people who just their brain changes. And so many people will tell me when they get off sugar for a while, they think clearly, they can make good decisions. It's not hard to stay away from it. The cravings go away. But the minute they take it into their bodies, they have that. It's live and it's well. And addiction, it makes no sense. And it's very, very powerful. So in your little piece of paper and on your fingers, count up how many little points you got. Now, this is going to shock you. All right. So the DSM, which is the Diagnostic and Statistic Manual, that's where psychiatrists and physicians and psychologists make our diagnoses, right? So we look in there and we're like, how many of these categories do you meet? Now, we no longer have alcoholism or drug addiction. That's not even a term anymore. What they say is substance use disorder. So sugar is a substance, so it can fall into these categories, all right? All right, you don't need to tell me how many. You're outing yourselves. All right, well, this is good because I'm guessing many of you are in line with some of these answers, all right? So 2 or 3 categories is referred to as a mild substance use disorder. 4 or 5 is a moderate substance use disorder, and 6 or more is considered a severe substance use disorder. Now, what does that mean? I don't know. Here's what I tell you. Does food cause a problem in your life? Does alcohol cause a problem in your life? Does shopping cause a problem in your life? Does gambling cause a problem in life? Does social media cause a problem in your life? Does spending 10 hours a day reading cause a problem in your life? If it's caused a problem, it's a problem, right? The extent of that problem, I don't know. But we can look at all the areas of your life and kind of figure out how many areas of your life is this affecting and how much of your time is spent not being present in your life, right? So you can call it an addiction. You can call it a problem. You can call it a substance use disorder. I don't care. But if it's caused a pattern of problems in your life, it's a problem. If you've continued to use it, and it, again, could be too much social media, in spite of knowing it's been a problem or there have been negative consequences, it's a problem. So if food or your weight has caused a problem in your life, it's a problem. Now, here's the deal. Weight loss surgery doesn't treat addiction. In fact, it often highlights your addiction because what are you going to do when they take your food away? Addiction is ruling the roost, right? The brain wants the fix. Your emotions are like, oh my God, I feel terrible. I can't stand to feel this way. Give me something. So we find something to replace that. That's why alcohol can be such a problem because, like I said, 1 drink equals 3. So very quickly, everything is right in the world, right? But it's not, because that becomes a whole different set of problems, right? So people often switch to alcohol, or they switch to spending, or they switch to, oh my gosh, so many people going into surgery are on narcotic pain medication that gets really out of hand. And I'll tell you another one that's huge that people don't talk about so much. SUD is a substance use disorder. I'm looking at the comments over there. Substance use disorder, meaning it's a problem, right? So sexual encounters is a huge problem after weight loss surgery for a number of reasons. So for one thing, people are like, damn, finally, look at me. I feel like I'm attractive to the other sex and I'm getting attention from people and people are hitting on me, or it could be the same sex, whatever, it doesn't matter. But I'm going to go out and I'm going to relive my youth. I'm going to go do Connie's, life as a teen slut. Only I'm in my 40s or my 50s or whatever. Doesn't matter, but there's a lot of hooking up because people feel like they missed out on that in their life. But it's dangerous. It's dangerous, right? For so many reasons, because people are hooking up with people they've never met before. That's dangerous. There's all kinds of sexually transmitted diseases. Then there's the guilt and the shame, and it just brings people down. In the meantime, everybody's going, wow, you're great. Look at you. What have you done? And you're like, on the outside, yeah, this is great. But on the inside, maybe that shame is getting worse and worse and worse related to your behaviors that people aren't even knowing about, right? So how do you deal with a food addiction, right? Because surgery ain't going to do it. You have to treat the two diseases separately. So if you have an addiction, you have to get treatment for the addiction. You have to continue to treat your obesity, and you treat your obesity with, the behavioral tools that Tasha is teaching you. I call these the gotta do-ems. In Connie world, it's the gotta do-ems. And I have a whole list of the research that says, if you want to lose weight and you want to keep weight off, these are the things you got to do. Right? So they're the gotta do-ems. And Tasha is walking you through that in your regain class. So you have to do those things, but that doesn't touch your addiction. So you have to treat your addiction differently. Now, there's many ways that you can go about this. There's 2 books I would recommend you read. One is called Weight Loss Surgery Does Not Treat Food Addiction. Hello, I wrote that, so I would like you to read that. The other one is called Food Junkies, 2nd edition. And that's important because in her 2nd edition, Vera Tarman, who is a medical doctor, talks about weight loss surgery in there. And so that's really good. And what's great about her book is that she helps you understand the biology of addiction in a really, really understandable way. I can't even touch that, right? But she will help you to do that. So she says, Dr. Tarman says, if you want to be free from addiction, then you have to be abstinent, completely abstinent. Yep, there's the book. You have to be abstinent from sugar and white flour and wheat and a lot of those things that can trigger your addiction. It's kind of like with alcohol addiction. I believe you can't really get recovery if you're still drinking, right? If you're still putting the substance in your body. Now, people have to learn this one the hard way, I'm afraid, especially when it comes to food. It's like, well, I'm going to have just a little, I'm going to control it. Well, that doesn't usually work, but go for it. Do what you got to do to get to the point where you're like, there's no way around this for me. I got to give it up. What do you mean? Give up sugar for the rest of my life? Oh my God, I could never think of doing that. Just like I felt. What do you mean? Never have a drink again? Everybody in my world drinks. What do you mean? Never have a pain pill again? Oh my God, how can I possibly do that? You do it one day at a time. You do it one decision at a time. You know, it's like, I can't do that for the rest of my life, but maybe today. And that's why you find groups like the 12 steps. There's a website called intherooms.com. They have all kinds of addiction meetings, all kinds of recovery meetings. It doesn't matter what the substance is. People can't really go to meetings right now anyway. But like Dr. Tarman says, you know, if the only thing available in your area, maybe they don't have OA. No, wait. What am I? Overeaters Anonymous. Yeah, OA. And a lot of people don't like OA. You can go to any 12-step meeting. You can go to Alcoholics Anonymous. You can go to Gambling Anonymous. Substitute food when people are talking about alcohol. It is all the same thing. But you can find food addiction meetings on intherooms.com. They have a schedule. You don't have to put your face out there. Nobody has to know. Just listen, take it in, see how this relates to you and applies to you. If you don't like the spiritual component of some of these programs, there's a program called Smart Recovery, which has nothing to do with spirituality or God or higher power or anything. If you don't believe in God, that's perfectly fine. You can still do the programs like AA or NA or OA, because they say higher power. Your group can be your higher power. It doesn't matter. It's just, there's got to be something bigger than me that can help me with this. So I'm going to read a couple of quotes. This time just goes too fast, but I want you to hear these. But Dr. Tarman says that to treat food addicts, it's necessary to completely detoxify your brain, to remove all of those substances. And I can't argue with her. She says, then the cravings will go away and you can start educating yourself, because recovery is not about getting rid of the substance. People who just get rid of the substance but don't learn about how to fill what's missing, why they're using in the first place, are what we call, are what we call dry drunks or white knuckling it. Like, you give up the substance, but you don't learn the skills to deal with how to live life on life's terms, because we use a substance to avoid. So just like with obesity, another diet is never what you need. What you need are the skills to get through, to follow what Tasha's talking to you about doing. So you don't need a diet. You need a healthy lifestyle. You need those habits that accumulate to form that healthy lifestyle. So be careful of whack-a-mole addiction. You just transfer one to another. And there are a lot of people that you can read about addiction. A guy named Gabor Mate, which is a weird name. I call him Gabor Mate because that's how it's spelled. Gabor, Gabor Mate. But he says the attempt to escape from pain is what causes pain. So I have pain, so I attempt to escape it by using sugar because I'll feel better. That causes more pain in addiction and obesity. So we attempt to escape our pain, but we create different kind of pain. And our symptoms are just ways we try to deal with our feelings. So what we need to do in recovery is learn to deal with life as it happens. People regain because I say, well, what was going on that you regained? Stress. Stress is the number one reason people say they regain. So do you need a diet for regain? No, you need skills for dealing with stress, right? A diet isn't going to fix your stress. Skills for dealing with stress are going to help you deal with stress. So recovery from an addiction is learning to deal with stress in life without turning to your substance. That's what recovery is about. That's why you need these additional programs. So, let's see, I'm going to skip a lot of that. Another, Gabor Mate says, your addiction brings emotional issues to your attention. So today, 31 years clean and sober, when I feel like, there are times when I still go, damn, I'd really like to have a cigarette. I'm like, all that's telling me is something's bothering me. I don't want a cigarette. I don't want a drink. I want something to take away whatever discomfort I'm having. So figuring out, what am I feeling discomfort about? So when you're finished with Tasha's class, I do a class called Gain While You Lose. And it's all about the psychological issues underlying the struggle to follow through with the habits that Tasha is teaching you with, because you know what to do. By the time you're finished with her class, you will know what to do. The struggle with following through oftentimes lies in those deeper issues. That's what my other class does. And it includes the addiction piece. So the thing about recovery from both obesity and addiction is, you lose the weight and that's great and all those good things, but you find yourself. And that's what it's all about. It's finding who you were born to be and living that through the rest of your life. So I'm going to shut up because, man, I could go for days. All right, I'll be quiet.
And I'll pop up some comments here.
Okay.
That I saw on you. Connie, how long is your course?
It is 10 weeks. It's how it works is it's once a week. We meet online for 90 minutes, and then I give homework that you do throughout the week. Worksheets.
And how often?
I do it about 2 or 3 times a year. And when people take that class, they can take it 15 times. You only have to pay for the class once. So you can take it again and again and again. Because this stuff needs to be worked over and over and over.
Mm-hmm. I'm going to go ahead and scroll down. I see a lot of, we're here. Thank you. This is really great. Let's see.
There's also Facebook groups that, like, I have a bariatric 12-step recovery group. It's a Facebook group where people are in there talking about their addictions and their recovery from obesity. Most of them have had weight loss surgery.
Mm-hmm. So some of these won't show names if they didn't accept the StreamYard. Excuse me. So many professionals do not have a clue. And this is where Connie, she is super connected with the bariatric community, and she knows us. She knows what we're dealing with. She's done it herself. So she not only, talks the talk, she walks the walk because she's been there. So she is one, and Connie, I'll post your link up to your group too, so they can join your group. I am in that group as well. She does amazing things for the bariatric community. And I'll also get your link for your course too, and I'll post it up under a thread.
Okay, thanks. But I'm telling you, what Tasha is doing here is remarkable, because regain is such a struggle. So always send your people here first. You got to start here. You've got to get these habits. You've got to know what they are and work with them before you can do the deeper work.
Mm-hmm. Shauna asks, what is our first step to face the pain or whatever is hidden deep within that makes us addicted so we can break the cycle, the root cause of our addiction, so to speak?
For many, many people, and not for all right, let me just say that. For a lot of people, there were things that resulted in your feeling not okay about yourself. And those things can range from being picked on at school. They can be, you know, messages that maybe you got them, maybe you really didn't, but you perceived them that way. Like maybe you were always compared to your sister or your brother. And so you felt like you didn't measure up. Those are, some of them, but they can go all the way to, like in my house, my father was an alcoholic. He was a very functional alcoholic. He had a good job. He never missed work, but it was insane living there. You never knew what kind of mood he was going to be in. My parents never said a civil word to each other. And I was terrified as a child, just constantly on edge. There was no physical abuse. There was no, but, and all those things, physical abuse, sexual abuse, being ostracized by peers, anything that makes a kid feel constantly anxious or nervous or not okay. Traumas, neglect are usually at the root. But not for everybody.
I see order. Oh yeah, I see sexual abuse on here. I'm just reading some of the comments. Wonderful live, works perfectly with what Tasha does with us. And you guys, Connie and I were just speaking about this before we went live. I am a master habit coach, but I can only go so far. And this is where Connie's course would take over if you need further help with addiction, because she is the expert in addiction. If you just have bad habits and behaviors that you need to get in check, then yes, my Back on Track program, perfect. But if it goes deeper than that and goes into the addiction, then I would absolutely recommend Connie's 10-week program. And like she says, you pay for it once and you can do it over and over and over. So you have no better support than right here with her.
Yeah. And really, these things do go to, and I respect you so much for knowing your limits. Like, I'm not an RD. I can't talk to people about, grams and nutrients and macronutrients. And so we have to know where our strengths lie. And so, we got to really reach out to each other, and get people where they need to be.
Mm-hmm. Tanya says, I got so much out of this amount of time. Thank you for taking the time out of your day to help us. And Connie is an awesome resource. And like I said, you guys, I will post up her link too to join her group. She is very active in there. And how many days a week do you guys do lives in your group?
It just depends. I usually am on there Tuesday at noon, but that's random. There's a couple of women who are on there live regularly. One in particular, she does the majority of work in that group, I will say. So it's just kind of hit and miss, but anybody can go on there and post a little live for 5 minutes, good, bad, or otherwise. But really, my work in this field is because what I learned 30 years ago is that you can't keep it if you don't give it away. And honestly, I'm getting older, and the more people who can carry this on and share the message and encourage other people, that's what it's all about.
Mm-hmm. Well, and I deal with this a lot, and Judy's saying this, I'm blown away. I get it, makes sense. She understands this, and she does. Is people get in this cycle, right? And it's that guilt, shame, and they stay in it. And it's, how do I get out of that? And then we do something else and we're right back in that cycle. Then we try getting out of it, and then they do something else and they're right back in that cycle.
Yeah, it does. That is a horrible cycle. And unless, just like with what you're doing, and I mean this is exactly right. You have to put effort into this. It's not second nature, right? So you have to work hard to change your thinking. You have to work hard. It's a constant effort for a really long time because you've been doing things the same way for the same time,
Mm-hmm. And that's the interesting part, you guys, is a lot of the things that I talk about with nutrition and habits and Connie, how we blend together. Because I talk to you about consistency and that you have to be intentional every day if you want to overcome things. You can't just pick and choose the days of when to focus, not to focus. You have to live your life with intention if you truly want to get past all this. And so Shauna says, I get that. We figure things out that hurt us, but then what? What's the next step? Your program or Tasha's? Then Shauna, that depends. So when does your program start, Connie? Your next program?
What? I will get one on the books. I don't have one on the books right yet, but because it's still January. So maybe toward the end of February we'll start doing it. So we'll give people some time to get set up, but get a therapist. And you know what? I tell people, go to a marriage and family therapist, which people are like, what do you mean? You're not married. I'm like, it doesn't matter. Go to a marriage and family therapist because for most of us, our issues start in our younger life. Even if that was the thing, I was absolutely adamant. I kept saying to therapists before I went to treatment, why do y'all keep talking about my family I grew up in? They're perfect. My family was a mess and I didn't want to face it. But for most of us, there are things in our childhood that go to a marriage and family therapist. They understand systems. Even if you're dealing with addiction, a lot of them don't know about addiction, but they understand the system, which is where the addiction came out of, or go to an addiction therapist.
Mm-hmm.
Hey, you know what I do want to tell you? I just started a podcast. It's called Berry Aftercare, the podcast. And there's only like 3 or 4 episodes out because I just started it this year. But that's another good free resource, you know? So, yeah.
And that link is in the group, you guys, and I'll post it up with this too. And Belinda says, Tosh, you're right on the money. Your course is amazing. I loved it, but I also know some of this goes deeper. And Belinda, it takes, when you recognize that it goes deeper, that's the time to seek out the resources that are there and work with somebody who has the expertise to really help push you through those issues. So like Connie says, you can live the best life that you are meant to live. And that's what it's about. How do you fix your mind is another one.
You know what that is? How do you learn a new language? You practice it. First, you have to learn the dialogue. You have to learn the words, and then you have to practice it. And it is really not, that sounds simple, but I try to learn Spanish. It's not easy, right? Without constant use of those words, I'm not going to learn Spanish fluently. And it's the same way with your mind. You have to learn the kinds of things to say to yourself. You have to become aware of when you're saying something negative about yourself. And then you have to consciously, intentionally, like Tasha was saying, replace it. And it is constant effort. It's constant effort for a while until it slowly becomes second nature.
Connie, what do you do when you're giving constant effort, but then you feel like you're constantly screwing up?
You go to therapy. Really, you have to have constant support. You have to have people around you. You have to have people who are along the same journey. Like 2 of my very best friends to this day are people I met in treatment. So you have to have people who understand the struggle, who are also working as hard as you are, because I guarantee you 99% of people are going to be like, yeah, whatever. And they're going to put it by the wayside. But there are people who are like, you know what? I'm on fire for a different kind of life. I am on fire for this. And one of the things they said to us when we were in treatment is, to what lengths are you willing to go to make your life better? And my husband and I, we loved each other, but we were in a bad, bad place. But we made the commitment that we were going to do whatever it took. And we did not have a lot of money for sure. And so I quit my job because that was part of the problem. It was part of the people and the places. They say you got to change your playmates and your playgrounds. Well, if I continued to hang out with those people, I was going to end up doing those things again. So I quit my job, which meant we lost my salary, which meant we sold our house. But we were willing to do whatever it took. And we bought a tiny little house and we moved next door to one of the people who's also my very best friend to this day. So what are you willing to do to get what you want? Are you willing to put in the effort or are you not? Are you willing to immerse yourself, read everything you can find, go to the meetings, listen to the other people? I was, because I hated where I was at in my life and I hated myself.
Mm-hmm. Tanya says, oops, let me show that one. I was just talking to Tasha earlier about my problems were more my emotions than my head, anything else. She was helping me with that, and you hit the nail on the head with all of this. People can succeed, but will keep falling back if they don't deal with the underlying problem. And Tanya and I literally were just talking about this same thing on the phone today, and she was helping me test alive to make sure it flowed, about that you have to deal with the emotion. You have, and I told her this exact same. I said, you have to feel that emotion. We eat, we drink, we sabotage because we don't want to feel, and it only occupies our brain space in the moment. But then you still have to deal with it. So you have to feel that emotion, whatever that emotion is. And I know it's uncomfortable as hell, but you still have to allow yourself to feel it in order to heal. Yes. And so it was so interesting that then that's brought up tonight on this live.
Mm-hmm. And learning to deal with feelings is really terrifying and really difficult. But you know what? That's where you learn to live life. That's how you learn to deal with it. It's like instead of reaching for the food or the drink, you go, what am I feeling? I'll give you this little foreshadow again. If you're feeling something and you become aware that when you're feeling this, I want to drink or I want to eat something. So one of the things you can do is say, what is it I'm feeling? And a lot of us aren't even aware, right? Am I angry? Am I sad? Am I upset? Am I nervous? Am I, feeling unloved? What am I feeling? And then you say, I could eat or drink something and I wouldn't feel that temporarily. That's an unhealthy coping mechanism because those are coping mechanisms. But what would be a healthy coping mechanism? I could call a friend and say, you know what, I'm feeling really unlovable right now. Could you remind me what you like about me? Or you could call somebody and say, I'm really feeling anxious about this. I have to meet with my boss and what I want to do is eat 6 donuts. Can you help me, walk me down through my feelings? I teach people to play the feelings game, which I taught my children when they were very, very young, and now my grandchildren know it. And sometimes I post it online because it's so just damn adorable. So at the end of the day, hey, Annie, just a minute. Come here a minute. I'll show you. She's 4. She just turned 4. Come here. I need you to help me show some people something. Come here. She's spending the night with Gigi and Jeepa. We're going to show some people some things, okay? We're going to teach them about the feelings game. What feelings do we do when we do the feelings game? We got to teach them how to play. What do you want to start with?
Sad.
Sad? Okay, so what do? We say, something I felt sad about today was what? What'd you feel sad about today?
That I left Mommy.
That you what?
Hey, Mommy left.
Mommy left? Yeah.
Mm-hmm.
So you were sad when Mommy left?
Mm-hmm.
I was sad today when Grammy was upset. What feelings should we do next?
Happy.
Happy? What were you happy about today?
That I got to have a sleepover here.
Yeah, I'm happy because we get to have a sleepover tonight too. What else should we talk about? What other feelings?
Angry.
Angry. What were you angry about today? Were you angry today?
Uh-huh.
What were you angry about?
'Cause my block of stacks that I made fell down.
The blocks that you made fell down?
Uh-huh.
You don't suck your thumb. Come on, you're mad. I was mad today when, what was I mad about today? Oh, yeah, when I went outside and it was raining and my sock got all wet. Do we have any other feelings we want to talk about?
Yeah.
What?
Angry.
Oh, we just did angry. Does it help when we talk about our feelings? Remember when Grammy was upset and we came in and we were talking about what he was upset about?
Mm-hmm.
Mm-hmm. Yeah. So you teach your kids and you teach yourself to identify when you're angry and what you're angry about. And then you say that I have choices. I could eat, I could drink, I could whatever. But what will serve me best? What's a healthy way to deal with this feeling? Talking, journaling, going in, and my grandson came in and threw a fit on the bed, hit the pillows, do something that's not going to hurt yourself or somebody else. You're a goofball. Do you want to go back out by Jupa now?
No.
You're gonna take your bath in a minute. You got your jammies on already. Why don't you run out by Jupa? Thank you. No.
Jeepa started to.
Jupa started to what? Put your jammies on?
Yeah.
All right, we'll go back out by him. Okay, so that's important to learn at that young age.
That was good. Shauna says, unfortunately, therapy is not an option for some of us, cost being one obstacle, let alone finding somebody that's qualified and good. So like Connie said, there's free resources. Connie's group, Tara's group, Tara has a group as well. Connie's podcast that she just started up. If you guys have not subscribed to that, I would make that first on your priority list when you get off this live call, is to subscribe to her podcast. And then, Connie, any other resources that you would recommend out there that you like?
Yeah,
trust?
Google's a great resource. If you look up, how do I deal with emotions? What are healthy coping skills? How do I overcome emotional eating? Here's what I do with a lot of those things. Read about 10 of them, and the ones that all say the same thing, they're onto something. Somebody may be way of an outlier and say something that's like, I never heard that before. Don't pay attention to that one. Because there's a lot of free information out there, but there's a lot of free therapy out there too. There's a lot of nonprofits. There's, call around, because you can usually and find somebody good. That can be tricky. You gotta test a few therapists. I've had some good ones and some really not good ones. So I understand it is a struggle, but it's easier now with therapy because it's all online. You don't even have to go anywhere. In the Rooms is free.
In the Rooms?
In the Rooms.
I'll put that down too.
Mm-hmm. It's really good. Annie, you cannot have that. Bring it back.
And Connie's podcast, after this live is over, I will put a link to all of Connie's stuff under a thread. So in my group, this group, I will have a Connie Stapleton thread that you can click on. And once you click on it, it's a tag. It will pop up with all of her stuff. So this video will be archived, so it will pop up with this video. If you want to rewatch it, it will pop up with her group, her podcast, her books, everything. So it's all in one nice little spot for you guys to find the information. Because I think it's super important for us to cross network, really, and to bring as many out there to the community that we can. Because there's people that they want to help, but we need to know about those resources. And Connie is one of them that we need to know about.
Thank you. Somebody's asking, is a podcast in Facebook? No, it's not. But you can go to podcast.berryaftercare.com. Podcast.berryaftercare.com. Or, if you're a podcaster, you know where to find the ones you like. It's on all of them.
Yeah, and if you click on the link too, you could bring it I brought it into Apple Podcasts. I'm not quite sure how Android works because I'm an Apple user, but it was super easy to bring it into podcasts on Apple.
Yeah.
Shauna says, I feel like a Bandit or maybe Bandit has been ripped off. And also, I'm wondering if I want microwave popcorn. How ironic.
That makes perfect sense because you're feeling stuff. You're like, oh my God, I just became aware of a whole bunch of stuff. Now I want to eat. Makes perfect sense. Just sit with your feelings.
Okay, Band-Aid. Yeah. And that's uncomfortable, Connie, to sit with your feelings and to, it's like when you want something like, because I transfer addicted and I'm very open about this. When I had complications with my plastic surgery, everybody had this expectations of me having plastic surgery, seeing the results. And I had this expectation of, here I lost all this weight, 140 pounds, and I'm going to have this perfect body after and have plastic surgery and, ooh, look at me, kind of thing, because here's the end of my journey, right? Yeah. And then I got a huge situation where I lost my implants. And so emotionally, I turned to the wine bottle. I didn't want to feel. I just wanted to sleep and not cry myself to sleep. So I didn't want to feel. So I went through a 20-pound regain, and my Back on Track program came because of that over the journey of how I learned to fight for myself again. And that was the first time that I truly fought for myself, because before that, I didn't fight for myself because I was over 300 pounds. And number two, my surgery did a lot of the work for me that first year and a half. I wasn't quite fighting for myself. When I got rid of my regain, that is the time that I truly fought for Tasha to come back. And and that was a slippery slope, right? But it was just like that where I want. And I knew I didn't want to feel. I knew I wanted to numb. But when you're sitting there and you're like, I want, and the craving's so strong, and it's like, what are you feeling? Why are you feeling this way? Who's around? Is there a trigger? And you're questioning yourself. It's super hard because you're like, okay, I don't want to deal with this. You know, I just want to soothe right now.
Yes.
But you have to make yourself feel and deal with it. Otherwise, but it's so uncomfortable. It is so uncomfortable.
It is.
I think that first is it's so uncomfortable.
Yeah, exactly. That's why there's a lot of relapse. What, baby?
And Judy says, thank you both for sharing your experience and getting back on track and headed in the right direction. I have a path of me and a journey of being the best I can be. Absolutely.
Absolutely.
At the end of the day, that's all we want, is to be the best versions of ourselves, right?
Absolutely.
Tanya says journaling has been a huge help for me. I thought it sounded kind of stupid at first, but I'm getting all my feelings out in a positive way, and it's extremely helpful. It takes a huge weight off my shoulders.
Yay. I'll tell you another thing that I'm doing. Here's another thing I'm doing. Begin anywhere. Begin with a journal. Write yourself a letter. Here's where you can begin. Here's what I would suggest. Write a letter to food. Just write a letter to food. Figure out what your relationship with food is. But I'm also going to be doing, I've lost my mind this year. I became a certified yoga teacher. So I'm going to be posting chair yoga videos and mat yoga videos online. Probably not for a couple of months because I got too much going on right now, but do some yoga. Go on YouTube and find some real nice, easy yoga. Yellow.
Let's see. We'll take a couple more. It says, amazing how Connie's program goes hand in hand with what we teach at Very Fit. And we do. Because I'm a habit coach. Yep. So Connie's a doctor. She's the psychologist. She goes a lot deeper than I can ever go. That's not my scope. But I'm a habit coach, and habits, we overlay each other. We really do. But for me, I know my scope of practice. So this is where I like the connection to refer over to, because I know my scope of practice and what I can do. And then if it goes farther, it has to go to Connie. You guys need that further help in addiction than me or anybody else who leads a Facebook group that is not certified, right? So Facebook groups can be a tremendous amount of support. But if they're overstepping their boundaries and they don't have the certifications, there's a problem.
You're so right.
You have to know your scope, build a connection so that there's resources for you guys. But Connie learns from me and I learn from Connie. I've learned so much during this time. So huge working relationship. Connie, did you see any questions that I'm missing?
I just saw a comment that I didn't know about this group. Speaking of learning, go to myfutureself.com and write a letter to yourself. I love that.
Myfutureself.com.
Yeah.
And we do an exercise too, saying goodbye to your old self. But that one takes time. It takes time for people to do, because that one's a pretty emotional part of the process. And I have a client right now that I've tasked her to do it. She's coming in close to goal weight, but she's not quite there to write that letter to old self yet. So it's a really powerful exercise when you're ready to do it.
It is, and you're right. You have to be ready because you're saying I'm willing to let go of my attachment to this food, and that's tough because it serves a purpose.
Mm-hmm. And there will be a replay to this. So again, you guys, I will tag it. I will tag all of Connie's links. There'll be a tag on this group, so you can just click on it and everything will pop up. I try to keep everything as organized as I can so that you can find it just at the touch of a finger.
Can I just borrow your skills somehow, Tasha? Gosh, you are organized and efficient. You really are.
Yeah, I try to be as professional as I can. That was part of so they noticed the difference in this group of we have challenges every Monday and daily posts and threads, winning Wednesday, meal prep Sunday. I spent about 3 months putting my head down, building up the Back on Track program, and really just bringing that professionalism to a Facebook group. So a lot of times when you join a Facebook group, you join it, and my thinking was, what do I want somebody's journey to be when they join a free group, right?
Yeah.
Because a lot of times you join a group and what do? Nobody welcomes you. They don't tag you in a post. Do you just scroll the feed and try to find things? And so when I redesigned everything, for those 3 months, I thought about when somebody joins this group, what do I want them to experience? And part of it is Connie Stapleton. I have sugar addiction. Okay, click on her name. Here you go. You find all the thread that Connie ever does in this group. Anything future that Connie does in this group is tagged. So I wanted people to have a great experience and feel like this is the group that I can trust. This is the group that I can be in and support. And they give me great referrals for some other resources that I desperately need. And just focus on those, because a lot of times when you're in all these groups and you're getting all this information, you could be getting bad information or mixed signals. It's very important that if you're focusing on sugar addiction, you know where to go. Tara's group, Connie's group, you know the resources. And so I really ramped it up for 2021, and I can help you all day long if you need anything. Because
a really nice compliment about I've never been in a group that's so amazing like Tasha's program. That's so nice.
Yeah. Thank you so much. I appreciate that. That was a lot of work, but it's worth it. It's worth it. Yeah. Connie, any other ones that you saw? I've tried different programs. They've never been so amazing like Tasha's program, and I still fail. You don't fail. The only time, here's my advice. The only time you fail is if you quit trying. If you just give up your hands and you quit trying. If you even give 2% effort a day, you're still winning. You're still trying. You're still winning. You're not failing. The only time you fail is if you just throw up your hand. I quit. I'm never focusing on this again.
Yep.
Period. You got to look at your wins. You got to look at your small wins.
Yep. Effort being good.
And you both are awesome. So I know, Connie, you got your grandkids there. So you guys, first of all, thank you so much for joining Connie and I. I hope that you really enjoyed this and took away a lot of things. And Connie, I want to give you a special thank you for making time out of your busy evening to first of all, join my group. And second of all, do this live with me. I think we met a couple years ago in Florida. I think you are an amazing resource. We actually had matching outfits too. I think you're amazing. Remember that? The little jumpsuit?
Jumpsuit. Crazy.
But I think you're just a tremendous resource for the bariatric community. And I appreciate the heck out of you and what you do for us. And that you get it. You absolutely get it. And you come from a place of non-judgment. So I love that dearly about you.
Thank you. And ditto to you, girl. I can't, you can post anything up on my Facebook group to let people know. class. Please do.
Yeah, thank you.
Yeah.
So awesome, you guys. Again, this video will be tagged. It will be up in the group forever. So you'll be able to view it over and over and over. Connie, I'll find out a date for her next course, and we will definitely promote it in this group for the next time she offers it. So anybody who wants to join that 10-week course, you guys have the information and you guys can join it. So Connie, thank you so much.
You're welcome. Thank you for
I
having me.
appreciate everybody on this.
Thanks, everybody.
Any last words? Okay. Bye. Thank you.
Bye. You're welcome. Thank you.